Okay, welcome to the first Standing Strong webinar of the year. We're going to be talking about exercise guidelines and dosage parameters. It'll be a bit of an interactive discussion for the people who are here live at the end. So if you're watching after the fact, you won't get that part of it, just so that we can maintain confidentiality. But you'll get this part of it, which will be the first, the main point to take home messages. So what we're going to do this year is once a month have a webinar, trying to synthesize the stuff that's most meaningful to you guys based on what you've told me, and just have a bit of a discussion about the main evidence-based findings, and then if there's anything particular coming up in your lives, we can go from there and hopefully help you out a bit. And we've got one more person to admit. So when it comes to exercise-based guidelines, there's a lot of confusion about it. So the first thing I'd like to say is that they're guidelines. So when you hear things like, oh, we need to do 300 minutes a week of moderate intensity exercise, you probably heard that one. It used to be 150, but then someone decided to double it just for fun. That's a moderate intensity physical activity guideline. Okay, but people often hear that and go, well, I'm not doing anything at the moment. Do I just start by doing 300 minutes a week? And then what they do is they go from 0 to 100, they go too quickly, and then they end up, hurting themselves or finding themselves low energy and all the rest of it. So the idea is that we have these markers or thresholds of where people tend to get fittest and most well-being out of based on population studies and the research. But remember, it's based on a population level. So individuals can still achieve good levels of health irrespective of whether they get to these figures or not. So I don't want you to think of any figures as like you must achieve this, otherwise you don't get any gains. But when we have a broad overall look at things, the people who tend to get closer to these do better. That's probably the biggest take-home message. So we're going to go into a few major categories. We're going to talk about physical activity. We're going to talk about strength. We're going to talk about balance. And then we're going to talk a little bit about bone loading. Okay. What I'm going to do after, you can take notes as you go, of course, just the things that matter to you, but I'm going to send separately to this webinar a bit of a printout so that you can, put it up and work it out yourself on your fridge or something like this. Okay, so don't have to worry about remembering everything. It'll be there for you. So some of these things we've started to talk about in class, so you'll hear hopefully some familiar patterns, but we want to just tease out a bit more info under it. So if you can understand the principle behind it, it's like anything in life. You then can apply it much easier rather than just being robotically like, I have to do this because someone said to do it, rather than going, well, why am I supposed to do this? And then you can actually appreciate that more. Okay. So I'll start with the physical activity. So the physical activity guidelines are different to, say, exercise. Now, the first thing is exercise and physical activity are technically different things, but they're related. So physical activity is any time you move your body, irrespective if you're trying to improve upon an aspect of fitness. It's just any movement that expends energy is activity. So if you're mowing the lawn, if you're walking the dog, if you're stacking the dishwasher, if you're standing up at a meeting, all these things are physical activity. Now, what happens is a lot of people are quite physically active, but they're not necessarily fit. And what that means is you can be moving a lot and doing lots of different activities throughout the day, but you might not be getting stronger. You may not be getting more balanced. You may not be getting more joint mobility or flexibility because you're not targeting them enough. Okay, so physical activity is important for a lot of health-related factors for sure. Okay, and I'm encouraging a physically active life. But sometimes people say, or often people say to us, I'm doing a lot of, gardening and mowing the lawn and housework and all that sort of stuff. Therefore, I don't need to exercise. And so to that, I would say, well, of course, it's your choice whether you want to do it or not. It's always your choice. But if you want to make certain gains, there's things that the physical activity may not give you that you might have to hone in on. Okay, so that's the big principle. So physical activity is good for health, and to be generally active throughout the day with all those things is very good for you. And to that, we have 300 minutes of physical activity a week of moderate intensity for all adults in Australia is recommended. So 300 minutes is, you know, you can either do it by 300 minutes of moderate intensity or 150 minutes of high intensity. Okay, so if you do a high intensity exercise, high intensity physical activity, you get to do half as much. But it's still 2.5 hours a week of high intensity. And you're like, what's high intensity? Well, high intensity is probably, it's defined as doing 6 times as much effort as just standing still, right? If we were to measure it in energy expenditure. So for me, that would be, I'd have to do 210 minutes of running to actually get there. For some people, it would be 210 minutes of brisk walking, or if you were doing it for 300 minutes at moderate intensity, you would have to do it for a lot longer, but a lot less intense. So we're talking about quite big figures for a lot of people. Some people are already making it, some people aren't. But we just want to say that the regular message is keep active, keep doing, try and start at your level and then just slowly increase bit by bit. Even if you're increasing by about 10% per week, that can be actually a good achievable goal without overdoing it. So that's physical activity. Okay. Now, if you're coming to classes because you've got a balance issue or a strength issue or a joint mobility issue, there's a good chance that your day-to-day routine involving whatever physical activity you do won't quite get you there because it's not specific enough. And that's the difference between fitness and physical activity. So fitness is when you are, or exercise, sorry, is when you are actually targeting a parameter of fitness in order to change it. So the difference, so I'll just go through that again. The difference between physical activity and exercise is that exercise is focused movement with the intent to change one or more parameters of fitness. So whereas physical activity is like I'm walking the dog because I've got to walk the dog, right? Whereas fitness would be I'm walking the dog because I'm trying to improve my walking. So they both can be the same thing, and I know it's a bit of a mental shift, but if we're talking about trying to improve on something, you have to target it. It doesn't just happen just randomly or on its own. So that's probably the biggest point. So if you're struggling with balance, you have to do balance. If you're struggling with mobility, you have to do mobility. If you're struggling with strength, you have to do strength. So that's the next part of the equation is there's a law of specificity in exercise and fitness and physical activity is that you get what you train for, you reap what you sow. So if you want to get better at balance, the only way you can do it is to be by practicing balance. If you are wanting to get better at strength, the only way you can do it is by doing strength exercise. If you want to get better at mobility or joint movement, the only way you can do it is by doing joint mobility. It really is that simple, but it's also that complicated because some people haven't been told that. So for instance, people will say, okay, well, I'm trying to get more balance, therefore I'm doing a lot of walking, that will help my balance. Now, unfortunately, that doesn't help your balance. It would be nice if it did, and walking's good, but walking's good for walking and cardiovascular fitness and all that, but it's not specific enough to really help you improve your balance to the extent that you need to do. Okay, does that kind of make sense? So that's the issue. So the first principle is that you want to have a generally active life, physical activity, and you want to do, you know, between 150 and 300 minutes a week, ideally. But you want to start where you're at and gradually build up and let it be into your routine. So that's your background level of activity of, you know, washing the car, vacuuming, all the chores you do, the shopping, all that sort of stuff that's active. Then under that, you want to have a fitness routine, which is actually targeting the very things that you have issues with or impairments in. So for a lot of over 65s, it's balance, as you know. So we'll go into the balance next. So the balance guidelines for over 65 adults is that we want to aim for 2 hours of high intensity balance exercise every week. So it's 2 hours of high intensity balance exercise every week. Now, for a lot of people, I mean, that's a lot, right? So that works out to be 20 minutes a day if you're doing it 6 days a week, yeah? But that is what it takes to get really good quality balance, and there's no way around it. And the people who I've seen do that, they just go really well, especially within the first 6 months that they've done it. So once they've done it for at least 6 months, they're starting to get some really nice gains. And some of you here have experienced that. And some people haven't experienced that because they haven't been doing quite enough. They'll say to me, oh, I've been practicing balance for a fair bit of time, but haven't noticed any changes. And the first question I will generally ask is, what intensity and how much are you doing? And they might say, I'm just doing it a couple of minutes a day and, just moderate intensity. You've actually got to do it a lot. You've got to increase the time and you've got to increase the intensity to be able to get it there. So that's really critical, especially if you've got a balance issue. And the number one treatment for falls prevention is balance exercise. Okay, so if you're concerned about falls risk or hurting yourself from a fall, the number one thing for most of you to do would be to increase your balance exercise. So I'll talk about that briefly now. So balance exercise is anything that challenges your ability to stay upright in the gravitational plane. And so don't think of it as just standing on one leg. That's of course balance, but there is also other aspects to it. Anytime we do reaching activities where our center of balance or center of mass is reaching outside our center of gravity, then we're going to be challenging our balance. So for instance, if we're reaching forward, our trunk and our arms coming forward and putting pressure on our feet to be able to maintain that. If we're reaching sideways, if we're reaching behind, if we're turning our head and looking, anything like that is going to be an aspect of balance. So that's one thing. The next thing is like anytime you are narrowing your base of support. So if you're going from a wide support with your feet to narrower, it's going to be harder. If you're going from narrower to a step stance or tandem stance or single leg or on your toes, that's going to challenge your balance. So that's another way to do it. The other way to do it is by stepping type exercise. So they're the three things that we do in class. We do reaching type stuff, we do stepping type stuff, and we do the actual restriction of the movement. And if you get all those variables right, then you're going to challenge your balance and so any exercise that does that is going to go towards that 2 hours a week. Okay. So for most of our classes, there's a high degree of balance involved. So a lot of you are getting like close to 45 minutes in the one class, which means that you've only got another hour and 15 minutes the rest of the week. So, and if you're doing it on the app where we've got balance exercise and you're increasing there, you're going to get a lot more. Okay, so just try and think of all of it as we're trying to jam it in there so that you can just keep chipping away at it. Okay, so the other thing about balance is high intensity. So when we think about high intensity, we often think, oh, does that mean we have to be sweating and breathing hard and our heartbeat up? That's intensity as far as cardiovascular is concerned, but it's not intensity as far as balance is concerned. So high intensity balance is the balance of the kind that if you were to score it out of a scale of 5, with 0 being the easiest and 5 being the hardest, you want to get to your own personal scale of pretty close to 5. Okay, so that would mean that you are focusing really hard to keep upright, but you don't want to do it so you don't want to tip over that scale where you're actually going to fall over. You always want to be able to recover, but you shouldn't be able to talk to someone or have a conversation or do 2 things at once if you're at that level, because it'll just be too hard. All right, so if you're doing an exercise for balance and you're finding that you can talk with someone, you can do multiple things at once, you can watch the TV, you can increase your intensity and then you'll make that more effective for you, if that makes sense. So that's balance. So just to recap, and I'll put this on the handouts, it's 2 hours a week we want to aim for, high intensity. And the way we can do balance is by changing our foot position. So stepping type exercises like tapping to the side, tapping in stars, doing all this sort of stuff, reaching with your hands or legs, and narrowing our stance. So that's probably the 3 major things. There's obviously much more than that, but if you think about that for a start, that will get you started. So that's balance. Now, for strength, now strength is something that not a lot of people perform true strength exercise because they've never been really trained to do that. There's a lot of people that do weights and things like this, but they're not technically performing strength training. So they're doing what I would consider muscle endurance training. So this is the next difference. So the difference between, say, muscle endurance and strength is probably best described in this analogy. So if you had two people and they were carrying shopping bags, and person A was able to carry 7.5 kilos of shopping and walk with it for, say, 50 meters before they had to put it down, and person B could carry 12.5 kilos of shopping, but they couldn't walk anywhere with it, person B would be the stronger of the two because they can carry more weight, even if they can't carry it far. So strength is how much you can lift, push, pull, carry, etc. in terms of gross mass. It's the amount of force you can generate against a load. Okay. Whereas person A would have better muscle endurance, which means that they might not be able to lift as much, but when they do it, they can do more with it. So it's kind of the difference between like a marathon runner and a sprinter, if that makes sense. So a sprinter would have more strength, whereas a marathon runner would have more endurance. Now, we need both of those things for everyday life, but a lot of people are very close to the threshold where strength becomes a problem, and that means that the amount of reserve they have between what an everyday demand requires of them and their ability to overcome that is very small, which means that injuries happen, you get tired quicker, and things become a burden. So for instance, if it takes a certain amount of strength in your legs to get out of a chair and you've only just got a little bit more than that, you're going to be performing it really close to your capacity every time. It's going to be a burden on you, okay? Whereas if you've got a lot more strength than that, where you could stand up and sit down with one leg, or you can stand up and sit down with weights and that sort of stuff, it just means that the difference between your absolute strength and the activity is so big that you don't get tired. And it'd be equivalent, think about like a car, like if you had a super powered engine getting up a hill, right, versus an older engine that's not been conditioned, not been serviced, all that sort of stuff, then it's going to struggle more and it's going to be more prone to injury. Okay, and the one with the bigger engine and the more power is not going to use as much effort to get up the hill. And that's the same thing with like muscle strength and endurance. So when we're coming to deal with strength, the recommendation is twice a week for over 65s, twice a week. Now, because it's harder, you don't want to ever do those 2 sessions on consecutive days. You want to have them 48 hours apart, because if you're putting in enough effort, you'll need that time to recover. Okay, so that's the thing. So what constitutes a strength exercise is where you can do something for about 15 reps, but generally not much more than that. So no matter what you're lifting, pressing, pulling, carrying, whether it's body weight, whether it's a band, whether it's a gym weight or machine or whatever, if you can just say, if it was a shoulder press, just say with a dumbbell you were doing that, and I could do, say, 23, 24, 25 reps and I'm still not getting tired, I would need to increase the weight to an extent where it was starting to get very tough towards 15, where I'm like, I just can't do any more than that. And that's the kind of thing you want to do for 15 reps, 3 sets, twice a week of every major muscle group. When I put that out on the pictorial, it'll make a bit more sense. So then you go, okay, well, how many muscle groups are there? Because there's 656 muscles in the body, and it would take a very long time to exercise each muscle if it had to work like that. But thankfully, it doesn't have to work like that. We'll simplify it for you today, where you just have to do a push, pull, press, and a squat. Okay, so we're going to just start there. There is more involved than this, but if we start here, we're going to make a good bit of progress. So what I want you to remember is 4 major movements. And in 4 major movements, you're going to get most of your strength exercises in your body. So the first movement is like any movement that presses overhead, right? So any movement that starts here and moves your shoulders up overhead, like your arms overhead, is going to engage your shoulder muscles. So we call that a press. That's exercise one. Anytime you go from here to here, whether it's at an angle, right, lifting your arms overhead, whether you're doing it with a straight arm or a bent arm, it's a press, and you end up working all your shoulders. Okay. Anytime you do a movement where you start here and you push out is a push, and you'll work out your chest and you'll work out your back of your arms, your triceps. So anything that pushes, where you're pushing up, forward, back, down, whether you're doing a push up, press up, anything like that, it's going to be a push movement, and it means you get your chest muscles and your triceps. So already with those two, you've got here, here, here. And then the next one is anytime you bring your arms back towards your body from up here to here, whether it's up, down, in between, any angle, you're doing a pull effort. You're going to be doing your up, like your back muscles and your bicep muscles. So with those three movements, a press, a push, and a pull, you're going to get shoulders, biceps, triceps, pecs, and back. So you're going to get your whole upper limb in 3 movements. So then you just need to do 3 sets of each one of those twice a week. And you can do that, I reckon, in about 10 minutes, 15 minutes a session, twice a week. And you'll make much more gains by doing that amount than trying to just plug away doing half an hour a day. And so it's actually good news, because people think, oh, do I have to do this every day for half an hour to an hour a day, which is just not possible for the most part. You can actually work smarter and end up getting more and more gains, but not necessarily have to put as much time in. And that's what we want people to understand. And the fourth movement is a squat type movement. So anytime you're squatting down, like sit to stand, lunging, bending your legs and straightening again, you're going to get pretty much the majority, like your whole lower limb. So in those 4 movements, you're going to get your whole body essentially. And if you're engaging your core and having good trunk control, you're going to get your core as well in those movements. Does that make sense? So again, it's press, push, pull, squat. 4 movements, 3 sets of 15 reps twice a week, non-consecutive days. And that's all I want you to remember. Write it out. It'll take you a bit longer to understand this in the balance, because there's a bit more involved. But if you were to do balance most days, even if it was just chipping away at it and strength twice a week, you're going to hit the guidelines. And it's possible in your routines if you can think about it correctly and not be overwhelmed by it, because it really isn't as much as it sounds. It's just about working really effectively. Okay. So take some time to get it. Not many people actually pursue it long enough to be able to understand it. And that's why people get substandard gains. But if you were to really work at it, like, the gains are incredible. Like, they really are. And you have people that it doesn't matter where you start. You can start at age 95 and you can make some wonderful improvements. So it's not age-based, it's consistency-based, and it's being smart, okay? Now, sometimes with strength, people can't do strength training because of a pain issue. So just say you had a shoulder rotator cuff tear, or that was actually quite painful, and you can't lift your arm overhead. You might not be able to do the press component to a sufficient strengthening stimulus to do 15 reps, because it would just be too heavy. So in those regards, you actually don't do strength for those grips, but you just try and get them moving back slowly, and you strengthen the rest of it. That makes sense. So you do it more as a rehab thing. So that's balance, and that's strength, and that's also physical activity. And you'll see that those 3 things that we've put into our Physio program as the main pillars of standing strong is balance, mobility, and strength. If you want to remember it, it's like MBS, the medical benefits scheme. M for mobility, B for balance, S for strength, in that order. That's how you remember it. Because mobility you need every day, balance you need most days, and strength you need twice a week. Okay? If you can just remember that, you're going to get most of the gains you need, like 80–90% of the gains you need. So let's just talk quickly about mobility, and then we'll wrap up, and then we'll open it up to just some interaction and questions and stuff. I might not be able to give you an answer. I'll give you an answer if I can, or I'll just respond if I can't. With mobility, when we think of mobility, we often think of walking, and of course that does mean walking. But when we're talking about mobility and standing strong, we're talking about the ability of the joints to move, which is overcoming stiffness. Now, for most people, we struggle with stiffness, especially in the mornings, and arthritis and that sort of stuff makes us stiff. And you just need to get the joint through the most range of movement, and especially experiencing different types of movements, right? So when we're walking around, we're just experiencing one type of movement in one plane most of the time, the forward and backward plane, but we don't get much side to side and we don't get much rotation. That's why we do a lot of side to side movements and rotations, like with our neck, our shoulders, you know, the spinning one, all that sort of stuff, the hips, the knees, the ankles, because we don't get as much rotations in our as we're exposed to it in our day-to-day lives. So the more we get those just full range of movements, lots of different, that's how the cells get renewed, by movement. Okay, so just think of movement as needing to happen with every cell. So don't think of it just as joints. Think about your skin needs to move, your joints need to move, the muscles in the eyes need to move, you know, your soft tissues need to move, everything needs to move. So all those forces are actually really good for you. And staying still for a long period is the thing. Now, that doesn't mean feel guilty when you're sitting down having a rest. You need to rest, right? But just try and get more movement into your body, and that's the real key. Okay, so people who fidget, it's actually you actually get more movement, so that's actually good for you. That's mobility. And really, if you're getting movement into your, especially the stiff spots of the body, which tend to be your upper back, which you need a lot of twisting for, and your hips, which you need that kind of rotation for, that's often where we need the majority of the movement, where we get stiff, because the ribs attached to here, and so it's more locked up, and there's lots obviously having at pelvis. So they're the 2 points that a lot of people feel really stiff. Whereas say your shoulders, it's just a lot more mobile joint, so you tend to get to there before you get stiff. So that's the idea about mobility. So doing lots of different types of movements and lots throughout the day. If you had to put it into a sessional, there's actually no sessional guidelines around mobility per se, except to say that if you did about 15 to 30 reps of a joint-based exercise and did that once a day, you'd be going pretty well, to be honest. So I often think with mobility, you find the bits that are the stiffest and you work on that. So sometimes it can be an injury, or you've had a knee replacement or an ankle fracture, and you'll need to work more on those joints than say other places. Okay, so we'll wrap up there before we open up, but they're the three or four major things. So just to recap, physical activity is like an umbrella of every movement that ever happens, but it doesn't have to be, it's not purposive for the point of building fitness. It's purposive for the activity, as in it's usually like I'm doing a chore, I'm getting this done, or I'm doing that, okay? Now, and that's important for health, and that's the 150 to 300 minutes a week. And then the fitness is where we're actually or exercise is when we're actually trying to improve our fitness, which is strength, balance, mobility, and other things. So if we want to improve our balance, the guidelines are 2 hours a week of high intensity exercise. If we want to improve our strength, it's twice a week, 3 lots of 15 reps of every major muscle group with the push, pull, press, squat. If it's mobility, we're doing like 15 to 30 reps of especially the stiff joints, which tends to be the back and ribs and the pelvis. Okay, so like those center joints, which need to be stable. And so what we've done is we've put it into the physio program to try and target some of those things, at least at the elementary level, with the idea that once you get momentum, we can actually expand them further to really target all those things. So if you're interested in expanding your fitness to the level of like, I really want to target these things, and you feel like you're at that level and you can put it into your routine, you can just let me know, and we'll just tweak those numbers. But we just started at an easy level, because the more important thing is to get into a habit rather than trying to go from there to there, if that makes sense. It's very easy to kind of go, oh, well, I'll spend 1 or 2 days doing it, but then you tire, then you get injured. You want to just slowly, you want to play the long game. And so that's how we've done it. So if you can understand that principle, I'm going to send you a little bit of a 1-page handout of all those things, so you can just kind of get to know them. That's the big picture message that you'll get no matter where you go in health, whether it's a personal trainer or exercise physiologist, physio, strength and conditioning. they're the kind of things that just don't change. They're the non-negotiables. Okay, I'm just going to stop the recording here.